Hi everyone. Today we will discuss about the C-reactive protein test. What is the use of this test and what are the normal values of CRP test? What is CRP? CRP is the C-reactive protein. So C-reactive protein is a pentameric protein having the 5 subunits. This protein is going to be elevated within the body when there is a inflammatory conditions as well as any trauma or infections in the body. All this can promote the C-reactive protein levels within the body. So C-reactive protein CRP acts as a biomarker for the inflammation. In many of the inflammatory disorders, the CRP levels are going to be increased within the serum. Now today in this video, we will see what is a CRP test and what is the role of CRP in our body and what happens when there is an elevated levels of CRP in our physiological system and what are the normal values of the CRP test. So when the CRP test is going to be done, as already we have discussed that the CRP acts as a biomarker for the inflammation. So when there is any inflammatory symptoms in the patient, for example, fever or tachycardia, increased heart rate and any infections in the patient, then the CRP test can be ordered. So inflammation can produce a few of the cardinal signs like the fever, chills, tachycardia, which may indicate that there is an inflammation in the body. In such case, CRP test can be done and inflammation in the body can be determined by another test, ESR, and both CRP test and ESR can be conducted in order to assess the inflammation in the body. And nowadays, the COVID-19 infection can affect many of the major organs and it can affect the heart, lungs, where it can produce some inflammatory disorders. In such case, again, we can use the CRP test in order to assess the inflammation within the different types of organs. So CRP test is one of the tools in order to identify the inflammation at the various organs. Particularly, this can be used when there is a cardiovascular disorders. For example, congestive heart failure, myocarditis, atrial fibrillation. Any of these cardiovascular disorders may be associated with the myocardial inflammation. In such case, CRP test can be done. And similarly, another important one is the blood vessels. The vascular system can be affected by inflammation within the blood vessel. So one of such inflammatory disorder is the atherosclerosis. Atherosclerosis is the block of the blood vessels by formation of an atheroma within the blood vessel. And this is observed in the patients having the high levels of the cholesterol. So in such case, again, the CRP test can be done. And any disorders which produce the endothelial dysfunction like the chronic hypertension or vascular inflammatory disorders, in such case, CRP test can be done. And another one is the rheumatoid arthritis. We know the rheumatoid arthritis is an autoimmune disorder which produces inflammation within the joints. So CRP test can also be used to assess the rheumatoid arthritis. And other disorders like the lupus as well as inflammatory bowel disorder, similarly appendicitis as well as pancreatitis, meningitis, in all these we can use the CRP test. And this test can also be used during the infections like the bacterial infections like the pneumonia, skin infections as well as the sepsis. In all these situations, the CRP levels may be elevated within the serum. So CRP test can be done in order to assess the state of the inflammation or infection in the body. So when there is an inflammation, the inflammation can cause the release of one of the important cytokine, the interleukin 6. This interleukin 6 can then act on the hepatocytes and it can stimulate the liver to produce the acute phase proteins. So one of the acute phase protein is the C-reactive protein. So inflammation can elevate the CRP levels through release of the interleukin 6. But this role is not only mediated by interleukin 6. Other cytokines like the interleukin 1 as well as the TNF alpha, tumor necrosis factor alpha, they can promote the action of the IL-6, thereby they can increase the release of the CRP within the serum. And not only the inflammation, any infections like the bacterial or viral infections can also promote the CRP levels within the serum. And particularly bacterial infections can increase the CRP levels by 1000-fold immediately in the serum. But whenever the infection is going to be decreased, the CRP levels again reaches to the normal levels. So a raised CRP levels within the body may indicate that there is an inflammation or infection in the body which should be immediately treated. So what is the role of this infection by the bacteria and virus? For example, the chlamydial pneumonia is one of a bacterial infection which can produce the pneumonia. This bacteria can also produce some erythematous plaque within the patients, which produce some inflammation at the endothelium. So this inflammation at the endothelium can increase the CRP levels. So the raised levels of the CRP can be observed with the bacterial infections like the chlamydia pneumoniae. Similarly, if you have the viral infections like the herpes simplex virus infections can also promote the erythematous plaque, so they can also increase the CRP levels. So infections caused by bacteria or virus can increase the CRP levels, and it is normally observed that the bacteria will have more effect compared to the virus on the elevation of the CRP levels. Similarly, Helicobacter pylori, H. pylori is one of a bacterial infection which produces the peptic ulcers. But this bacteria can also produce some inflammation in the stomach which may increase the CRP levels. In this way, CRP levels are going to be raised when there is an inflammation or infection either by bacteria or virus. All this can elevate the CRP levels, which is one of a good indicator of either inflammation or infection in the body. From where CRP is released? So C-reactive protein is going to be released from the various tissues. The important one is the liver. From the hepatocytes, mainly the CRP is going to be released. But CRP can also be released from the endothelial cells as well as the adipose tissue as well as the muscle cells. So from so many tissues, the CRP is going to be released during the inflammation or any infection. Normal release of the CRP is mainly observed with the liver cells. So within the hepatocytes, the CRP gene, the C-reactive protein gene can release the CRP, which is the N-CRP, that is the pentameric protein, and CRP can also present as monomeric, that is MCRP, but this pentameric form is having the more effect than the monomeric form. This N-CRP or pentameric CRP is going to be stored in the endoplasmic reticulum by formation of a complex, and this complex can also be detached so that this N-CRP is going to be released into the serum. So there is a basal release of the CRP which is less than 0.8 mg per dl, which is normally released from the hepatocytes. So any conditions like the inflammation, trauma or infection can activate the inflammatory cells which will activate the caspase 1. This converts the pro-IL-1 beta into IL-1 beta form, which is one of the important initiator for the release of the cytokine IL-6. Now when this IL-1 beta form is going to be released, it can stimulate the release of the IL-6. This IL-6 is then going to promote the CRP gene, C-reactive protein gene. And if you have the other cytokines like the interleukin 1 and TNF alpha can also promote the expression of the CRP gene. So the CRP gene is more expressed within the hepatocytes, which release the excessive levels of the N-CRP. This N-CRP is going to be again forming a complex with the endoplasmic reticulum. But when there is an inflammation, the interleukins are going to be elevated. These interleukins can promote the detachment of this N-CRP from the endoplasmic reticulum, so that this N-CRP is going to be excessively released in the serum with elevated CRP levels. So inflammation, trauma or infection can elevate the CRP levels by producing more CRP from the hepatocytes. What happens with the elevated levels of CRP? We have seen that interleukin 6 along with the IL-1 and TNF alpha is going to promote the release of the CRP during the inflammation or infection. But what happens with the elevated levels of CRP? Whether it is only a biomarker or it is having any effects on the physiological system. Definitely CRP acts as a biomarker, but apart from that, it is also having few of the physiological roles. When there is an increased levels of CRP, it can decrease the expression of the ENOS, endothelial nitric oxide synthase enzyme, which results in the decreased nitric oxide production. Nitric oxide is very important for the endothelial function, but here the elevated levels of CRP is going to decrease the nitric oxide production. And the raised CRP levels can also increase the ROS, the reactive oxygen species, which produce the oxidative stress on the cells. So the elevated ROS along with the decreased nitric oxide production can produce some endothelial dysfunction. Whenever the endothelial dysfunction is observed, it can promote the atherosclerosis as well as other vascular disorders. Similarly, the elevated levels of CRP can also increase the endothelin 1 receptors on which the endothelin can act and produce the vasoconstriction. So whenever the endothelin 1 action is going to be increased, it again increases the endothelial dysfunction because of the enhanced vasoconstrictory response. Similarly, the raised levels of CRP can also increase the opsonization, which results in the uptake of the oxidized LDL by the macrophages. When these macrophages are going to uptake the oxidized LDL, they can be converted into foam cells, which is one of the important pathological process in the development of the atherosclerosis. So raised levels of CRP can further increase the atherosclerotic plaques by increasing the formation of foam cells. And finally, CRP can also increase the apoptosis as well as the fibrosis of the tissues, and it can produce the tissue damage. We have already seen that IL-6 is the initiator for the release of the CRP. So IL-6 is going to be elevated during the inflammation or infection, which promotes the CRP levels within the serum. And the raised levels of the CRP can then promote the macrophages. These macrophages, when they are stimulated, they can release a few of the cytokines, and one of the important cytokine is the IL-6. This IL-6 further increases the inflammatory response. In this way, the raised levels of CRP can further increase the inflammatory response by release of the cytokines like the IL-6. Effect on the endothelial cells. The raised levels of CRP can activate one of the important protein, MCP1, monocyte chemoattractant protein 1. So this MCP1, when it is going to be stimulated, it can cause the infiltration of the monocytes and macrophages, which will promote the inflammatory response. So this MCP1 monocyte chemoattractant protein 1 is more expressed by elevated levels of the CRP. Oxidative stress, which is observed with elevated levels of CRP, can also promote the MCP1, and few of the cytokines like the IL-1, IL-6 as well as TNF-alpha, all this can promote the action of the CRP, thereby they can increase the MCP1 action. When this MCP1 action is going to be increased, there is more infiltration of the monocytes and macrophages, resulting in the enhanced inflammatory response. And this may result in the endothelial dysfunction and formation of erythematous plaque, and so it can increase the cardiovascular disorders. In this way, the elevated levels of CRP indicates inflammation or infection within the body, and which should be immediately treated. Otherwise, the elevated levels of CRP can produce some tissue damage as well as enhance the inflammatory response, and it can also produce the apoptosis. That's why the CRP level should be tested during the inflammation or any infection in order to control the inflammatory response. So standard CRP test is going to be done in order to assess the CRP levels within the body, where the blood sample is going to be collected from the vein. And the normal values of the CRP test are going to range from 0.8 to 100 microgram per dl. These values can also be expressed in another way, like 8 to 1000 microgram per liter. You can see the denominator is different. In the first one it is deciliter, in the second one it is liter. So the base value is 0.8 mg per dl, and it can be ranged up to the 100 microgram per dl. But nowadays, the HS-CRP test is more preferred, where HS indicates the high sensitivity C-reactive protein test. These values are more accurate, and HS-CRP levels can be again expressed in the milligram per dl. And based on these values, we can also assess the severity of the risk of inflammatory and cardiovascular disorders. If the HS-CRP levels are less than 1, the risk of cardiovascular disorders is low. If it is 1 to 3, there is an intermediate or medium risk in the patients. But when the levels are elevated greater than 3 mg per dl, there is a high risk of cardiovascular disorders. So whenever these HS-CRP levels are elevated greater than 3, then it indicates a high risk for the cardiovascular and other inflammatory disorders, so it should be immediately treated. Sometimes you can also observe the HS-CRP values abnormally around 10, which indicates an abnormal value. In such case, this test should be repeated in order to assess the correct values of the HS-CRP. So HS-CRP, high sensitivity CRP test, better indicates the inflammatory conditions within the body, and for an optimal condition it should be less than 1, and when it is elevated above the 3, it indicates a severe risk in the patient. So that's about the CRP test and HS-CRP test. CRP is one of a important biomarker for the inflammation or infection in the body, which acts as an important tool in order to diagnose the prognosis of the inflammatory disorders. So that's about the CRP test. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.